Good morning and welcome to Meet a Missioner Monday. It is great to be with all of you again. Thank you for tuning in from around the world. For those I haven't yet met, my name is Karen Bortvet Estrada and I will be your host for these Meet a Missioner Monday gatherings. In a special way today, because we're interviewing two essential workers, I wanted to take a moment to thank all of our essential workers around the world, those working in hospitals, those helping to make sure that we still have food on our table, whether it's harvesting, transporting, stocking, or selling us the food, and the many essential workers that we probably don't see around the world. Thank you for your service, and know of our prayers for your safety, for your health, and for just treatment of you as you put your lives on the line for the rest of us. For those who are new to Meet a Missioner Monday, we hope that you enjoy our interview today. We think of this as an opportunity to check in on our brothers and sisters around the world and see how they're doing in this time of physical distancing. We'll follow a similar structure to what we have done the last few weeks. We have a couple of questions prepared for our guests, and then we will open it up for your questions. So if you have any questions, please put those in the comments. Depending on the device you're looking on, those comments will either be below this video on your screen or they will be off to the right. So put any questions or comments you have there. Also, we'd love to see where you are tuning in from. So please let us know where you're watching from so that we know the representation we have from around the world. Now, without further ado, I would like to welcome our guests this week, Dr. Ann Berry and Dr. George Stablein, who are joining us from Tanzania. Ann and George have been serving as Maryknoll lay missioners since 2016, and prior to that was a Jesuit volunteer, and then they met at Penn State College of Medicine. After their time there, they went on and served for 5 years at a community health clinic in West Virginia. So welcome, Ann and George. Thank you so much for joining us.
Thank you very much.
Thanks for having us, Karen.
So the first question that I would love to ask you is just how did you end up with Maryknoll lay missioner? What led you and your family to be with us as Maryknoll lay missioners?
Well, I can answer that mostly because it really started before I even met George. As you said, I was a Jesuit volunteer and I served with Jesuit volunteers in Managua, Nicaragua. And when I was in Nicaragua was when I first heard about Maryknoll lay missioners. I had just graduated from college and I thought it sounded like a wonderful thing that I'd love to do someday. And I also had such a wonderful experience with the Jesuit volunteers that it made me want to do something else like that again later in my life. So I had that just in the back of my mind as a dream for someday.
And I would say, to piggyback on that, that I actually had potentially a very different plan for my life in the very beginning, before I knew Ann, and was planning on going back to southwestern Pennsylvania and practicing as a general pediatrician after finishing med school and residency. And once I met Ann and saw how much mission had meant to her through the Jesuit volunteers, and she had shared with me her interest in going abroad again and sometime in the future. I really began thinking about how it would be for me to be able to do something like that. And it took a lot of encouragement from Ann, saying, I really think you'd be a good missioner, George. You'd have to give yourself a chance, because I just didn't know how that would work for me, how I would be able to do with that. But it's something that I've really been grateful to Ann for having the opportunity, for introducing me to that opportunity, and for being able to do that.
And I know that you both did not go to mission alone. You have two daughters. I think we have a picture of them here that can come up. Maybe you can tell us a little bit about your two daughters, Louisa and Susanna, I believe.
Mm-hmm. Susanna is 9 and Louisa is 6. And they are they're at a friend's house right now. Otherwise we would introduce you to them personally, but you can see them in front of us there. They've really been having a really pretty amazing time here. Susanna's very interested in music, and she's kind of she likes to act and kind of be a little bit silly and act, put on shows. Actually, and her little sister Louisa is definitely following in those footsteps. It's been a real joy to watch them kind of grow here in their Swahili, and with their friends here, and it's been just a real joy. In fact, Louisa, she was only just about 3 when she was 3 when we came here, and so Luisa's memory of her kind of growing up in large part has kind of started here, and so it's kind of funny. She has bits of memory from West Virginia where she was born, but it's been really fun to kind of hear her talk about her thoughts and kind of how things have how living here has been for her. It's been really good for both girls, I think.
That's awesome. For those who are just tuning in, we are talking today with George and Anne on Meet a Missioner Monday. They are live with us from Tanzania, and you can hear the sounds of Tanzania in the background there. If you do have any questions for them, please be sure to put those in the comments, and they will be happy to answer those for us at the end of our Meet a Missioner Monday. Now, I'm hoping that you guys could tell us a little bit about what the ministry is you have been doing sort of pre-pandemic. What did that ministry look like for you?
Yeah, we would love to. I think you already said, Karen, I'm a family doctor. And so I have a special interest in women's health and maternity care. So you can see there a picture of me in the Reproductive and Child Health Center at the hospital where we work. And in that picture, I'm teaching a little learning session for my colleagues who are nurse midwives and some nursing assistants who do the prenatal care and the care for children under 5 in that center. And I was doing a little teaching about Rh negative blood in that one. And then in this picture, this is another smaller part of my ministry, but it's been a real joy and also real challenge for my Swahili skills, which is leading workshops mainly on women's health topics with other projects that work with young women and girls. You can see this is a sewing school that one of our fellow lay missioners, Angelica, works with up in Musoma, which is just a few hours north of the Serengeti, and we're a few hours south. So so I have done a lot of these different workshops with different groups, and all in Swahili, which is very challenging, but has also been a real joy to spread that information and knowledge and really help, hopefully, young women feel more empowered about getting good care for their own health.
And in your ministry, it sounds like you work with a number of different folks. Is there somebody in your ministry who's been particularly inspiring to you, or someone that you work with there in Tanzania?
Yeah, many people for sure. I mean, that last picture was of me at our hospital. Another thing that I do at our hospital is just help out with or participate in the cervical cancer screening program at our hospital. And I do really admire all the nurses and nurse midwives that I work with there, who are really dedicated to women's health. And particularly, in this program, what we do is a very simple method of cervical cancer screening. It's not like the Pap test that we do in the United States, or the more advanced like DNA tests, but it's just a simple application of vinegar to the cervix, and then we just look to see if the vinegar can show any signs that could be a cancer or pre-cancer generally. But if we do see a sign of that, for the most part, we have to refer a woman to a bigger hospital, because we're an hour outside of the city of Mwanza. So in our hospital, it's a very rural community. So we don't have any, specialized treatment there for pre-cancers. And the women I work with are very dedicated to following up and really supporting our patients to get the care that they need. But in particular, also when you asked that question, I was thinking about a woman that I know just personally as a friend, but George has worked with her also professionally and in her work. And her name is Sifa. And she's she's half Ugandan, half Tanzanian, but she works here in Mwanza. And we met her here through some work that she does with a program for children who have hydrocephalus and spina bifida. And so George will tell you a little bit more about that program because he's actually worked with her as a pediatrician. But I just think it's really amazing how dedicated Sifa is to these kids. She herself is a single mom and has a little girl who's good friends with our two girls, and you know, between our kids' ages. But even though she's, you know, she has her own family responsibilities and personal responsibilities, she is always there. I mean, really, like weekends, late at night, if there's an emergency, there's a problem for one of the kids at the hostel, health hostel where she helps and where she works, she does whatever it takes to help them, and she just loves them so much. It's amazing to see her face just light up with joy when she's able to give good news, or you know, something's worked out for one of those kids. So yeah, I really admire Sifa.
I think that's one of the things I greatly appreciate about Maryknoll Missioners is all the folks we get to work with in our ministries. So yeah. George, now I have to ask, the picture came up of you dressed like Saint Nick. So can you tell us a little bit about your ministry? Is that your full-time ministry there, walking around like Saint Nick, or was that a one-time occurrence?
That was a one-time occurrence. It was, yeah, so it's definitely not part of my full-time ministry. But again, it was working with our friend Sifa. She said, you know, I really want to, you know, she has these children with spina bifida and hydrocephalus in this hostel, as Anne was talking about. And they are admitted to the referral hospital in the city here in Mwanza, where the neurosurgeries are done for treatment of these illnesses. And sometimes these children are admitted and readmitted for long periods of time. And she really wanted to, you know, to kind of give them a little taste of being out of the hospital and kind of give them something special for a day. And so she said, you know, boy, George, I would really love if you could, if you or somebody you know could find a Santa suit or something like that, and wear it in the hospital, and we could actually, you know, give out some gifts to the children and their families on the neurosurgery ward. And so I just happened to have friends, which I didn't know this about them at the time, but they celebrate the Feast of St. Nicholas, and they actually have a costume that they brought with them from the Netherlands. And so so they very kindly, very happily lent that to us, and I became Saint Nick for the day. And it was there were a few children who didn't understand who Saint Nick was, and it was a little bit scary to them, perhaps, you know, just like the children we've seen in pictures in the United States, where the little kids, you know, they cry when you put them on Santa's lap, kind of thing. But it was really, it was a really cool, fun experience for me, and it was something that that I'll definitely never forget. And our whole family, Anne and the girls and I, were all there, and so our kids getting to see that, they helped with handing out the gifts and things. It was a lot of fun.
So when you're not playing Saint Nick, what does your ministry look like? What is your everyday work?
Well, I have two different ministries that I mainly do. One is also working in the same hospital where Anne does the cervical cancer screening. There, I'm kind of, I guess you would say, function as kind of an equivalent of a staff pediatrician there, and as well as I kind of help to run the pediatric ward. And so my days generally, I spend there 3 days a week. In the mornings, I round in the pediatric ward, um, and try to figure out what things are urgent and kind of basic inpatient medicine. Um, and then after I finish there, I go to the maternity kind of newborn unit, and I round on all the babies there. And if there's an issue in the meantime, I may be going to the outpatient department to see a child who comes with significant or special issues, or to the HIV treatment center. They occasionally call me over there to see a child. So I kind of consult throughout the hospital. I am the only pediatrician there, the only one with significant pediatrics training, and so I try to help with some quality improvement initiatives there, and just kind of work on what the day-to-day patient care there for children. The other 2 other days during the week, I work with a group that's it's structured as kind of a public health department under the Catholic Church here, the Catholic Church is run by Maryknoll Fathers and Brothers. And before I came, they had started a program for kind of physical therapy for working with children, a support group for the families, and also physical therapy for children with special needs, meaning things like cerebral palsy, or who maybe have had a stroke or have other sorts of brain damage, or spinal cord damage, among other things. And so it started off with me just kind of advising a little bit as I was learning my Swahili there. And as time has gone on, it's become me kind of screening every child that comes in for any health issues, trying to give medical advice, and kind of working with the physical therapists, physical therapy assistants that we have to really work to improve to try to improve the children's health. And from that program actually came kind of something that had really inspired me when I was working in West Virginia. I got the opportunity to do school-based healthcare, and here that was pretty much a foreign concept. But we started seeing, when we were trying to do, our health department was trying to do an inclusive education program. They were finding that a lot of the children that were being brought to them to see if they qualified for special education actually had chronic health conditions that could be treated, or could at least be improved upon. And so I started doing a health screening program in one of the local primary schools, and that's been it's been a pretty cool experiment to be able to do that. It's something new here, and it's something that I really enjoyed. It's given me a very kind of good glimpse at what kids live with here on a day-to-day basis, that they kind of tolerate as potentially a fact of life when it could be a treatable condition.
So for those just tuning in, you're watching Meet a Missioner Monday. As you can probably tell, we're talking with 2 doctors. George is a pediatrician and Anne is a family physician. Both of them are serving in Tanzania. I'm always just so impressed when I listen to those of you that are medical missioners talk about the real direct life-saving impacts that you're having on folks where you work. I'm wondering if we can shift now a little bit to talk about how your ministry has changed. I know for all of us, there's sort of been a pre-COVID-19 and a post-COVID-19. What does that look like for you in Tanzania?
Well, I mean, one thing for me in terms of my ministry is what happened was my main ministry, as I said, was in the Reproductive and Child Health Center. And one of the services, there's us with our nice masks, but one of the services that we have in the RCH clinic at our hospital is the clinic for prevention of mother-to-child transmission of HIV. And it's this really wonderful program that is a national program in Tanzania, but from the government Ministry of Health. So we participate in that, and we offer very close monitoring and support and encouragement, as well as medical treatment for women who have HIV and are pregnant, and then for them and their child up until 18 months, when the child, hopefully the child has definitely not become infected. And it's very successful. The vast majority of the babies born to the mothers in our program never get infected. And yeah, it's really very rewarding for all of us, I think, who work with these mothers, and of course, especially for the mothers. So because of that, I do work some with our HIV care center, because that program is based out of the HIV care center because it's for women with HIV, but the physical location of the clinic is in the reproductive center, so that the mothers, when they come for their pregnancy checkup, and then they just go right next to the next room for their HIV, care, medication, and consultation. So they don't have to go to two separate places, really make it easy for them. And that's how the national program is designed. So it's an excellent program. Because of that, I guess I have that familiarity and that link with the HIV care center. Well, our HIV care center at our hospital is run by a wonderful, another person I really admire, who is a doctor from Italy, who's also a lay missioner, but with a different organization, an Italian organization, I guess, named Rosa. And Rosa, just before the coronavirus pandemic started, she had gone home to Italy to visit her elderly parents for their 50th wedding anniversary. And then she got stuck in Italy because, of course, now we all know what happened to Italy. So Rosa still hasn't been able to return to Tanzania, although she should have been back now a long time ago. So she asked me, would I stand in for her at the HIV care center, doing the medical part. Of course, I can't run it because I don't know all the administrative stuff, but at least I can be the doctor, because she's the only doctor on staff. There's a clinical officer who's excellent also that works there. So that's what I've been doing now. So I've shifted completely. So that's been the biggest effect on my ministry personally, is I've shifted into totally different work, which is doing all the HIV care for all the patients with HIV, not just the pregnant mothers and their babies. But of course, other things that have changed is we're just working really hard to prevent infection of ourselves, all of the workers in the HIV care center and the whole hospital, and our patients, particularly the ones living with HIV, because we imagine they'll be quite vulnerable to this virus. Although so far I haven't seen the research or data coming out about that, but it is a big challenge, because I think, Chris, maybe you could put some of those pictures back up of the buckets. Like George sent you some pictures of the buckets that we have to use to wash our hands, because the hospital does have a water system, although we're too far outside the city to be part of the city water. But the water system that the hospital had broke a couple months ago, which is very bad timing, because now, of course, we want to do really good hand washing, but all we have is these buckets with a little spigot you can see coming out the side, until we can get this system repaired. So that's one thing we're kind of working on the side, is trying to raise some money to get this water system repaired. But as you can imagine, it is a big undertaking. So we'll see. But for the time being, we just have these buckets with spigots and soap on these nice little wooden stands all throughout the hospital for both patients and visitors, but also staff. Yeah, that one's set next to a sink, so it drains into the sink, but the sink has no water coming from it right now. So the buckets just have to be refilled, by the hospital staff every time it's empty. Then they go out and refill it. So it just is like, oh, what bad luck that we have even this extra challenge now just for the simplest thing of hand washing. So that's just kind of a little picture of those kind of challenges are kind of normal here in Tanzania. And I think probably you would agree, Karen, in mission in general, those are the little challenges you just don't even think about when you're just living in the United States, that the conveniences, I guess, that we have in the United States that, of course, we can all take those kind of conveniences for granted. So we don't now.
Oh, yeah, for sure.
So before we jump to George as to how your ministry has changed, I just want to remind folks, if you do have any questions for Anne or George about their ministry, their lives in Tanzania, or their work, please feel free to put those in the comments, and we will be getting to those very shortly. Okay, George, how has your life changed?
Well, I would say, I haven't had a tremendous, change in the type of work I'm doing like Anne has. I have, we have definitely had some other challenges in our hospital in relation to coronavirus. In particular, the children's ward where we generally would admit the children and where they would stay, sustained some damage, some significant damage from a storm back in October, which blew off the roof and caused the rain, and the rain caused the ceiling board to come down. So because of that, which is in early process of hopefully being repaired, the children have been shifted to the other side of that ward, which is actually where the women are admitted in the hospital. It's the female wing of that building. And so the issue is, particularly when there are young children who are admitted, and they're potentially in the same room or in the next room over, there are two of these kind of group ward rooms. Children, but particularly young children, don't necessarily know or effectively cover their coughs and sneezes. And so trying to protect, if there is a child with coronavirus, trying to protect the potentially elderly female patient who could also be in that same ward from being infected has proven to be a bit of a challenge. We are working until that children's ward is repaired fully. We're working on trying to figure out how the best way to do that. What is the best way to do that? With regard to my other ministry, my work with the children with special needs has changed significantly. We're not seeing each other face to face these days, mostly because we have stopped the exercises, the in-person exercises, because of the not wanting to have large groups of people coming together. And also the school where I work has been closed. But I have been in phone contact with the staff that I work closely with there with the children with special needs, and we've been working together to help children who have any healthcare needs, any healthcare emergencies or problems that can't wait. And we've worked out a program with a hospital local to that community to be able to admit them or have them tested, and to help to support those children, some of their care financially, which has proven to be a kind of a good shift in this time.
I think what really strikes me as you're sharing is just how that intersectionality plays in. And when we're talking about struggles on the margin, it's not just a pandemic, it's, a missing roof, it's a lack of infrastructure for water, and those things just sort of compound the challenges that we're facing. So exactly. I definitely appreciate all you two are doing and how you're helping to try to overcome some of those challenges. We do have a couple of questions that have come in. First, we have a shout out both M. Jolie and Tim Devaney, who were in the same cohort as Anne for the Jesuit Volunteers. Say hello and thank you for sharing. Someone wanted to clarify, what part of Tanzania are you in right now?
Oh, well, we, our hospital is in a village called Bukumbi. And Bukumbi is right on the Gulf of Mwanza, which is just a little tiny offshoot of Lake Victoria, basically a very narrow offshoot of Lake Victoria. But we actually live in the city of Mwanza, which is just right on the southern edge of Lake Victoria.
And we have a question from Tina Stadola. Sorry, Tina, if I said your name incorrectly.
Tina.
Tina is wondering, what was the biggest personal challenge to serving there or with your family, and how about the rewards?
Do you want to start?
Sure. One of the biggest challenges for me in the beginning, outside of overcoming the language barrier in the beginning, which would be the same in any non-English speaking country, of course, for me was getting used to what sort of care I would be able to provide, and the resources at my disposal. In the U.S., granted, even in the U.S., we worked in low income areas. We worked with some significantly impoverished families, but there was a bit more infrastructure, or significantly more infrastructure, for supporting that. And so here, I can't necessarily order potentially the blood tests or the the CAT scan, or even the X-rays, things like that I would have ordered, to ensure my kind of suspected diagnosis, or to give me some sort of idea as to what potentially what was going on with the patient. I have to be much more trusting of my own physical examination and kind of, my own ideas based on the likelihood of, what illness it may be, and a lot less on kind of auxiliary tests. And so that's been something that it's been a challenge. I think it's been stressful, and it's also been helpful, I think, in helping me grow as a healthcare provider, being able to kind of trust myself more in certain times, and really kind of it's really helped me to hone my physical diagnosis skills a bit more. So it's been a big challenge, but one that I think has made me potentially a better healthcare provider.
I think, for me, I don't know, I guess living in another culture is always a challenge in so many ways, and such a joy as well. But yeah, it's I think maybe my biggest personal challenge has been just that struggle that we all go through to try to understand enough about the culture that I'm in, that I can be respectful and relate to people that I'm working with, and participate, and have something to offer and something to give. And I guess part of that also is like not feeling useful. I mean, now, like, we've been here, 3.5 years, and we're telling you all the stuff we do, and it sounds like, oh, we're so useful, we do all this stuff, it's so wonderful. But the truth is, like, at the beginning, it takes a long time. Yeah. And like any of you who've been in any kind of cross-cultural service or mission know, it takes a long time to just the language alone is enough to, to give you a big challenge, of course, as George said at the beginning. But then there's all the cultural things, and just get, like, it takes a long time to settle into any new job. But this is like exponentially more, because you have to just figure out how you can fit in, and I had to figure out how I could fit in, and how my gifts and my experience, what I had to offer, could fit in. And it seems like, and it's interesting. I mean, it was an interesting thing for me, and I was reflecting recently that when I was a Jesuit volunteer, I had just graduated from college with a bachelor's degree in linguistics, which, as my parents always said, oh, that's so useful, Anne. So obviously that wasn't useful to my JV service. And so I didn't have any professional skills. I just had, like, oh, I'm interested, I'd like to help. And I had that same challenge of finding out, how could I be useful? How could I serve? I really wanted to help people in need, but but it's not enough just to want to do it. You have to, figure out how, and that takes a lot of patience and humility, and trusting other people to ask again and again, how can I help, and trust that maybe the things they suggest you should try, even if they don't sound that good to you at first. So I think I did have this idea that, well, okay, now I'm a doctor. I have this experience, training, I have a tangible skill, like I can go and, help sick people as a doctor. And even as a doctor, it was still really hard at first. And all the cultural layers of not just the culture of Tanzania, but the culture of the healthcare system in Tanzania, you had to figure that, and the language, and yeah, it's a big challenge. But I think that's also where some of the biggest benefit for me personally has come, because it's such a good lesson in humility. I mean, I think it's always a good lesson in humility to try to live it as a guest in someone else's culture and in someone else's language that you don't really speak or understand very well. And it really brought me and continues to bring me back to humility as, not humility that I'm no good, I'm just so stupid, I can't even speak Swahili better than a 5-year-old, which is probably true, but the humility that I am a beloved, child of God, no more so or less so than any other beloved child of God here on this earth. And yeah, I've really discovered, I've had a lot of spiritual, personal growth being here. And a lot of that thanks to our Maryknoll community too, that's been, that's so supportive, and we have a lot of resources there, both with the other lay missioners, but also the fathers and brothers that George mentioned, and the Maryknoll sisters. We gather and have prayer, reflection, and different things, spiritual direction, opportunities, retreats. But that by itself wouldn't be enough for me. It's the actual experience of that struggle to figure out, well, who am I? What can I offer? And before, my medical skills or my doctor experience, or, that's part of it, but more important than that is, what do I have to offer is myself. And we each have that to offer. So it's, but it's very humbling. And that's a real gift.
Thank you. I think that's one of the things I'm going to carry with me this week, is that idea that wherever we are, we all have ourselves to offer. And even if, we're physically distanced and shut behind doors, trying to do our little part, we can all offer ourselves in this time of pandemic to those around us. So I would like to take the opportunity to thank both of you for calling in all the way from Tanzania. Thank you for joining us this morning. And thank you to everybody who tuned in to watch. We do have a special request for you today. Tomorrow, as folks may know, is Giving Tuesday Now, which is something that folks are participating in around the globe to try to support nonprofits and to their service in this time of COVID-19. As you heard from Anne and George, the needs are still there, the needs to serve in many different ways, and a lot of different pieces of the ministries still need support. And just like everyone else, there's financial struggles that have come up. So if you do find yourself in a place that you are financially able to support, Maryknoll Lay Missioners is joining Giving Tuesday Now and trying to do some extra fundraising to support our missioners overseas in this time. We're also very lucky in that we have an anonymous donor who has offered to match any donations that come in through the end of the month, up to $12,000. So what that means for you is you give us $1, and by the time it gets to us, it's become $2. I don't know about you, but I would like all my dollar bills to turn into $2 bills. So it's a great opportunity to double your support. We will be right back here next week on Meet a Missioner Monday with Joanne Blaney, who will be joining us from Brazil. Joanne is a long-term missioner who has been doing restorative justice work and also works with people experiencing homelessness there in Brazil. So again, thank you to Anne and George. Thank you for everyone who joined in. And until we see you again, please stay safe, be well, and may the 4th be with you.